Are you really never in the mood to have sex with your partner? Do you find yourself avoiding situations where you might have to be alone with them and they might try to have sex with you? Well, I'm Dr. Rena Malik, and today we are talking about low libido or low sex drive. If you're new here, we talk all about urologic health, bladder education, sexual education, and much, much more. I know that a large portion of my audience is male, and thank you guys all so much for being a part of this community. I do hope that you will share this video with your female partners and friends just so they can learn more about their libido and if there's something wrong and they should see someone about it. This video is launching a new section of videos that I'm going to be talking about women's sexual health as well as male sexual health. So please, if you are male, watch this video, learn something, and share it with your female friends. In this video, I'm going to focus in on what are the causes of low libido in women. And in the next video following this, I'll talk about what we can do about it. But to start off, what exactly is low libido? How do you define it? Well, the medical term for it is hypoactive sexual desire disorder, or HSDD. This is clinically defined as a lack of motivation for intercourse, either with lack of responsiveness to spontaneous desire, meaning that you're having lack of response to sexual thoughts or fantasies, or a lack of motivation from responsive desire, meaning that when you're actually having some erotic cues from your partner, you're just not that into it. And lastly, you have a lack of desire to either initiate or participate in sexual intercourse. And oftentimes in these people, we'll find that women are avoiding situations where they might have to have sexual activity with their partner, or they're really only participating out of fear or concern for their relationship. And another thing that really defines this as a problem is that it's a change from what you were before. Not something that you've always been, but that you've all of a sudden noticed that this has changed and it's been lasting for at least 3 months. But the most important thing here is that this should be causing you some clinically significant distress. And what I mean is, like, you're really having relationship issues or personal issues from this problem. Some people have really no issues. They're just not that into it and it doesn't bother them or their partner, and that's totally okay. I will also want to really clarify that this is different than mismatched desire. And what mismatched desire is when your partner has a desire for sexual frequency that's more or less than you. That is a other condition entirely and does not mean that you necessarily have low libido. So how many people actually experience low libido? Well, if you look at survey studies, you'll find that 40% of women do report some experience of low libido. However, only 10 to 12% are really bothered by it. So those are the people that we are talking about here, if you're bothered by it. And if you're bothered by it, this can be really significantly impactful. It can cause decreased self-confidence, decreased self-worth, and decreased self-esteem. It's often more common in people with a spouse or a partner. And if you've been in a longer relationship, it's actually been shown that these sexual problems become more problematic over time. In people with partners, we find that over the course of relationships, as the relationships get longer and longer, sexual activity and satisfaction with sexual intercourse do tend to decline. It's important to know that women with low libido will often have other sexual dysfunction issues. So they may have issues with arousal, with orgasm, with lubrication, and other issues like pain with sex. And those can cause the low libido or be kind of interlinked with low libido, so fixing them sometimes will fix the issues with low libido. But before we get into that, I want you to understand exactly how the brain works when you are aroused, because that will kind of explain why certain things are more likely to cause low libido. So when you're aroused, certain areas of the brain are stimulated, and those are called sexual excitation pathways, and they use certain chemical messengers or neurotransmitters. Specifically, a big one in sexual excitation is dopamine. And when you're thinking about sexual inhibition pathways, are typically when you are not wanting to have intercourse or you're done having intercourse and you're in that sexual refractory period is what we call it. These pathways light up, and they typically use hormones or chemical messengers called serotonin and sometimes things like opioids. So when you're thinking about things that may cause low libido, there's a couple factors that are at play. Drugs or medical conditions that either decrease brain dopamine, increase brain serotonin, or increase brain opioids will cause a decrease in sexual excitation. Conversely, drugs or conditions that either increase brain dopamine or decrease serotonin release can actually cause an increase in excitation or a decrease in the inhibition pathways. If you look at people with HSDD or hypoactive sexual desire disorder, will have either a predisposition to having more activity in the inhibitory pathway, or they may develop brain changes that kind of either decrease the amount of excitation they get or increase the inhibition. In one study, they looked at women with HSDD or without it, and they had them watch erotic videos, and they took brain scans. And here you can see that the brain scans are very different in the HSDD brain versus the non-HSDD brain. So if you're suffering from HSDD, this is not something that you are doing. This is because there is different brain chemistry and different activation in your brain that's causing this. As I mentioned earlier, many women who suffer from low libido also have issues in other areas of sexual dysfunction. And so these risk factors that I'm going to review are not necessarily specific to low libido, but they may cause other issues that can also cause low libido. Causes of low libido can include psychological conditions such as depression and anxiety, relationship issues with your partner, fatigue and stress can certainly play a role. Certain medical conditions and medications can contribute to these symptoms, and physical conditions that can make sex painful can also cause people to have low libido. So as far as psychological problems,
oh ha ha, it's so funny, my vagina is depressed.
A big one that women suffer from is impaired body image. So feeling like they're unattractive or their body is not the shape they want it to be. And so working on that can be helpful in increasing libido. Also, going through pregnancy and childbirth adds a lot of stress, a lot of fatigue, body issues, and there's hormonal changes, and all of those things can affect libido. In fact, when they studied 400 women who had their first baby, they found that at 3 months after pregnancy, regardless of whether it was a vaginal birth or a C-section, 83% had issues with sex. And at 6 months, there was still 64% of women who experienced some issues with sexual function. So this is very, very common. You are not alone if you're in this situation. Also, just having children itself or struggling with infertility, those issues are linked and found to be correlated with low libido. Moving on to medications, there's several medications that are used for psychological conditions, specifically selective serotonin reuptake inhibitors or SSRIs, which are commonly used for depression, can cause low libido. And so if you are on one of those medications and you're struggling with low libido, talk to your psychiatrist and see if you can get those changed. Also, some antipsychotic medications and medications for anxiety called benzodiazepines can cause sexual dysfunction or low libido. Another area that I think is really interesting is oral contraceptives. So the data is inconclusive that oral contraceptives cause low libido, but I will say that I've heard this so often that people on some sort of hormonal contraception can have changes in libido after starting contraception. So if you find yourself in that boat, please talk to your gynecologist about possibly changing your contraception. In fact, we're doing a study right now where we're looking at what people report on Reddit about low libido, and oral contraceptives were a big thing that were reported on Reddit, and I will absolutely share those results with you if you are interested once we publish them. So medical conditions, there are several medical conditions that have been linked with low libido. One is diabetes mellitus, and the thought process behind that is that there may be changes in the nerve function because diabetes affects nerves all over the body, which can cause some genital numbness. That's similar to certain neurologic conditions like multiple sclerosis, also Parkinson's, and some epilepsy or seizure disorders. People can have low libido associated with that. We've also seen it in people with chronic renal failure on dialysis and patients with high blood pressure. And it may be either the high blood pressure or the medications, such as beta blockers, that are linked with low libido. People with chronic pain disorders, which kind of makes sense. If you're in chronic pain, you're probably not that interested in sex. And also people who have been recently diagnosed or just finished cancer treatment can also have low libido. All of those things kind of make sense. As far as things that can make sexual intercourse uncomfortable or painful, things that include pelvic floor dysfunction or high tone pelvic floor, having a prolapse can make it uncomfortable, or having leakage of either urine or stool called urinary incontinence or fecal incontinence can obviously make wanting to be intimate a little less desirable. Also, in women who have chronic pain in the pelvic region, obviously that makes it less desirable. Or if you're postmenopausal and you're going through what's called the genitourinary syndrome of menopause, where you've lost estrogen in the vagina and this causes the tissues to be very thin and less elastic, can cause a lot of pain during intercourse. And I'm going to make a video on that as well later on down the road. So if you're interested in learning more about that, please make sure to let me know so I know to make it sooner rather than later. And lastly, certain gynecologic conditions like fibroids or endometriosis can cause pain with deep penetration, and those that can also be contributing to some aspects of low libido. I hope you guys found that useful. Stay tuned for our next video on treatments for low libido. As always, remember to take care of yourself because you're worth it.